This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
So when it comes to surgery, smaller is better. And that brings us to interventional radiology, which can precisely target therapy as opposed to open surgery. So let's learn more about interventional radiology at St. Joseph's with Dr. Pavan Khanna, the Medical Director of Interventional Radiology at Dignity Health's St. Joseph's Medical Center. Dr. Khanna, thanks for your time today. So how does interventional radiology work?
Hi, Bill. Thanks for having me. So interventional radiology is a pretty unique specialty in that we're able to perform minimally invasive procedures using imaging guidance. We can actually perform, everything from the simple procedures, or what we consider simple, or the biopsies and drainages of fluid collections, all the way to treating and removing blood clots from the lungs and legs. We treat compression fractures in the spine, whether they're related to osteoporosis, trauma, or cancer. We can also perform minimally invasive treatments of cancer, particularly in the liver, kidney, and bone. And what we're seeing is actually similar response rates to surgical procedures for those indications. And, we perform procedures all the way up to those life-threatening ones where people have bleeding, arising from arteries and veins anywhere in the chest, abdomen, pelvis, extremities, you name it. And we're able to perform these minimally invasive treatments going through the arteries and veins and stopping them from the inside. In total, we do I'd say about 75 or so unique different procedures. And again, some of these required open surgery, and now we're able to do these in a minimally invasive manner and able to reduce complication rates and recovery times for most patients.
That is a wide range of procedures. You said 75. Holy cow. So let's stick with liver cancer since you mentioned that. Tell us about the specialized treatment for that with interventional radiology.
Sure. So what we're seeing actually is liver cancer is actually on the rise, and we're able to treat not only primary liver cancer, but secondary liver cancer that arises in a different site in the body and travels to the liver. One of the procedures we've been doing for the last couple of years is a procedure called radioembolization, and that actually entails us actually just going through an artery in the groin, so it's a little needle poke in there. Through that needle, we're actually able to guide tiny little wires and catheters up to the arteries in the liver, similar to if a patient has had an angiogram of the heart. Same kind of concept, but we're actually focusing on the liver. And so what we do is most of the tumors in the liver are actually supplied by arteries, and about 2/3 of the liver, the organ itself, is actually supplied by a vein. So it's a very unique organ in the body. But what we see is that because those tumors are supplied by the arteries and not the vein, we're able to deliver high doses of either chemotherapy, in which we would call it a chemoembolization, or little beads that have radiation in them directly into the artery supplying the tumor. And that's what we call radioembolization. And we've been doing that, like I said, for a couple of years now. We actually do more cases here at St. Joseph's than any other hospital in the state of California. And we're probably in the top 3 for all hospitals, including academic and community centers on the entire West Coast. So we've had great success rates. Patients tolerate the procedure well, and we're getting great results so far.
So with this technology, you can target precisely where the treatment needs to be. Is that right? You were talking about liver cancer. You can find that vein where that problem area is and target it precisely. Is that right?
Absolutely. And so when we're doing these procedures, we're injecting contrast dye into the arteries, and that enables us to see via X-ray the tumor sort of light up when we're in that artery supplying it directly. And once we get into that artery, like I said, we can deliver little beads that have either chemotherapy in them or radiation in them. And so this is something, a lot of patients who present to us either are not great surgical candidates or not good candidates for liver transplant. And so what we're able to do is actually provide them a really great treatment option and potentially either have to avoid surgery or at least keep their disease under control while they're waiting for another definitive treatment option.
Yeah, and that is really important. So you were talking about radioembolization. I imagine one of the benefits of what you're doing now with this is that patients no longer have to leave the community, right, for specialized cancer treatments. They can stay right there. That's probably one of the reasons you're doing more cases than even the university hospitals.
Absolutely. And so the interesting thing is that a lot of these minimally invasive treatment options for the liver previously were really done at most of the academic and university centers. And so being in Northern California, we have several surrounding us. But my goal was to bring that procedure and those technologies to our community so that, like you said, the patients would not have to leave the community. And so, with that, we're able to deliver really comprehensive cancer care here at St. Joseph's in conjunction with our medical, surgical, and radiation oncologists.
So important and such a great benefit to the community. So, Dr. Khanna, I'm thinking a lot of people may have never even heard of interventional radiology. So if you could wrap this up for us so we all have a common understanding of this, especially for the person listening right now, how would you describe interventional radiology so we all have a basic common understanding of what this is?
Yeah, that's a great question because a lot of people don't really know what interventional radiology is. We sort of started as a subgroup of diagnostic radiology where we started doing interventions, but now we've kind of taken on a totally different role. And like I said, as I mentioned, we're doing all these different kinds of treatments, even cancer treatments. And so it really comes down to, we are minimally invasive surgical specialty where we're able to offer these treatments with really an incision no greater than about half an inch in the body. And we're able to deliver these treatments and provide options for patients that, like I said, previously required open surgery. In doing so, we're able to reduce complication rates and recovery times. And so, to sum it up, I'd say, well, we do procedures using imaging guidance that we're able to cover pretty much, from the neck all the way down to the toes, and do all different types of procedures with involving different organs of the body.
What an exciting advancement in technology. Dr. Khanna, thank you so much for explaining this to us today. And for more information on interventional radiology, please visit stjosephscares.org. And if you like what you've heard, please share it on your social channels and be sure to check out our full podcast library for topics of interest to you. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.